you are walking around throwing up, you're dehydrated because the medication is making you sick, then that is really not improving your quality of life. Is there a drug that's more effective than semaglutide? So the answer here is maybe. The initial data on tirzepatide seems to indicate that it is slightly more effective than semaglutide. But at the end of the day, is semaglutide useless? No, they both appear to be very effective drugs. Now, interestingly, we have several years of data on these and other GLP-1 agonists. The tirzepatide is a combination, but with the semaglutide, someone else asked, are there any downsides to semaglutide? And there certainly can be, the main one being nausea. So most people are wanting to lose weight to improve their quality of life, but if you are walking around throwing up, you're dehydrated because the medication is making you sick, then that is really not improving your quality of life. However, in these studies, about 90 to 95% of people are able to continue taking the medication. It seems that that nausea tends to lift over time. And one strategy to reduce that is to start with an even lower dose than is recommended in the study. So typically they're doing a auto titration every 4 weeks. The dose goes up, the dose goes up, the dose goes up. When in actual clinical practice, you can start at half of that initial dose or even lower, and you can increase the dose more slowly and only when the weight loss is not occurring at the rate that you and the patient have decided on in the plan. So there's ways to kind of get around that particular downside. One of the things that I find particularly interesting is the increase in exertional heart rate that is accompanied with the higher doses of semaglutide. And this was seen in the studies as well, I believe. I'm not really sure what the potential mechanism is there. Some people have reported fatigue, and that's usually if the energy deficit is too large. If you have someone and they go on a diet, they're just going to tend to move less. You're going to be a little bit more tired because you're not consuming as much energy, not taking in as many calories. So there certainly are some downsides to semaglutide, but for the most part, there's ways to mitigate those.